Somebody reached out to our office recently looking for tips for folks who have higher BMIs. In this case, this patient's BMI was over 50 when it comes to top surgery. So I'm going to share with you guys my top 3 tips for folks with higher BMIs who are seeking top surgeries. So when it comes to top surgery, going back 10 years now, I haven't had a hard and fast BMI cutoff. It's every patient is assessed individually. And so I always ask patients, however, to look into their future because we want to think about the longevity of their results. So what I mean by that is if the patient is pretty sure that weight loss is in their future and it's a significant amount of weight loss, we're talking 50, 100 pounds, they may possibly need a surgery in the future to get rid of loose skin on the chest. Now, I have a lot of patients who've done this because it's very common that once we get rid of the chest, patients feel better, they go to the gym, and just lifestyle changes alone, they can lose a lot of weight. So the second thing to understand is this is specialized surgery, and you want to make sure that your surgeon has plenty of experience in dealing with folks with a similar body type to yours. Over a BMI of 40, we do see higher risks of infection, but also we see higher risks of things like dog ears and sunken in areas or too much tissue left behind. So make sure you see before and after pictures from your surgeon of people with a similar body type. So my final thought on these surgeries is what we call a risk-benefit analysis. So we always want to be safe. Safety is our top priority. And so if necessary, we may have you see other docs such as cardiologists. We'll discuss things with our anesthesiology colleagues and just really help the patient understand the risks and benefits. The great news is we have a lot more data and a lot more science behind gender-affirming top surgery in folks with larger BMIs, and it's looking good. It's not as risky as was once thought. I've been offering it without a BMI cutoff for 10 years, but of course within reason, making sure that we are as safe as possible. And usually what I'll do with patients is present the facts to them, tell them about the risks, and many patients, because their dysphoria bothers them so much, will want to move ahead.